we have in our final segment of today's edition of the MegaCast a special presentation from Dr. Betty Chu, Associate Chief Clinical Officer at Henry Ford Health System, in partnership with the Greater West Bloomfield Chamber of Commerce, to provide an update on where we're at in the COVID-19 pandemic. As of Wednesday, Michigan reported 27,423 new cases, or an average of 13,712 for each of the past 2 days. Now, numbers and these trends starting to trend back down, but for a while now, especially since the onset of the Omicron variant here in the local area and across the state of Michigan, we have seen a surge of COVID-19 cases that has affected how we've dealt with this pandemic across the board, including and especially in our health systems. We'll bring in Dr. Betty Chu, now the Associate Chief Clinical Officer of Henry Ford Health System. Dr. Chu, thank you for being with us.
Great. Thanks, Tyler. Really appreciate you having me on today. Can you hear me okay?
Yeah, we can hear you just well. So we understand you have a presentation for us on with information on COVID-19 and where we're at in this. You may start whenever you would like.
Sure. Yeah, I'm going to share some verbal comments primarily. I've got some prepared comments just to kind of tell folks how we're doing as a health system, but also just to, of course, encourage folks on some of the key points that people are hearing out in the media. And then, Tyler, I'm happy to take questions from you, from the audience, whatever. I know we've got a relatively brief period of time together, but let me just open with a couple of general comments, okay?
Okay.
All right. Well, I think, as you mentioned, we continue to see some really positive signs that Omicron surge is slowing. Our hospitalizations as a health system, we serve 4 counties, have been declining since last week, and our number of infections are down slightly. For Oakland County in particular, where I know a lot of your listeners are from, there's been also a decrease in the death rate, as well as a decrease in the number of positive tests. I think that's certainly reflected by people, of course, seeing that in their own lives with their kids in their schools and other things like that. These hopeful signs are definitely making us more optimistic that we've seen the worst of the Omicron surge. I don't think any of us expected to have sort of this double force of Delta and Omicron running into each other and leading to a pretty challenging December and January. That isn't to say that Omicron isn't around still, that it's still not a threat in the community, because it is. And so we really would encourage people to not let their guard down, to continue to do the things that they need to do to help prevent infection. The pandemic, unfortunately, isn't over yet. We're not done with it yet, and it's not done with us yet. This also means, of course, please wear a mask in public, regardless of your vaccination status, in particular in indoor spaces. And we've noticed that folks are washing their hands less. I've noticed that when I went to the restaurant the other day. So I think washing your hands, of course, basic hand hygiene is really important. And of course, the biggest thing that we can do to protect from infection is getting that vaccination, and also making sure that you're up to date on vaccination. So I'll make a few comments about vaccination, because I know there's a lot of questions that I get as a physician when I'm seeing patients in my office around vaccination rates. Because our vaccination rates are still relatively low, we're still going to continue, of course, to see infections. There's, of course, a lot of natural immunity that also occurs as well, but vaccinations are still the best thing that offer us protection from dying. And that's really the focus, is that vaccine is going to help prevent the mortality or the deaths that we have been seeing so much of in the past couple of years. Couple of things that, of course, have come up recently is, what do we mean by fully vaccinated? Get a lot of questions about that in my office. The CDC, of course, is using the language now up to date versus fully vaccinated. This is a very common way that we talk about vaccines. My kids have had their measles, mumps, and rubella, and they're up to date. I've gotten my flu series this year, and I'm up to date. And so as we start to shift the language for the COVID vaccines to using this up-to-date strategy, what that will tell you, too, is, so if I've had 2 shots of the COVID vaccine, but my last dose was a year ago, then I'm not up to date. I need to get a booster, because what's recommended by the CDC is, for somebody who's my age, I should have a booster, and that would make me up to date. And that's going to help protect you, give you the most level of protection from infection. It was clear, based on more recent studies, that getting that booster, getting up to date, is going to help protect from the variants and from Omicron and specifically. So the CDC, of course, is advising that, as well as Henry Ford Health System. We're strongly advising that people stay up to date. We do that because we have recognized through our own internal data that more than 90% of people being hospitalized for COVID have not received that are vaccinated, have not received their third dose of vaccine. So while you are hearing there's an increase in folks that are being hospitalized that are vaccinated, many of these folks are not up to date currently on their vaccination. That is, they haven't received that booster dose. And of course, we're still seeing the preponderance, or largest percentage of people that are hospitalized, and the largest percentage of people that are dying in the hospitals are the unvaccinated. Couple of things to share again from a data perspective. The 4 counties where Henry Ford has hospitals, Jackson, Macomb, Oakland, and Wayne, only about 55% of those eligible to be vaccinated have had their first 2 doses, and only 45% of people are up to date on their vaccines, which means they've gotten their booster. Again, if you know, as you probably know, the CDC also recommended boosters for teenagers aged 12 to 15. I immediately went out and got my 14-year-old his booster dose. So my whole family has received their boosters. Unfortunately, the vaccination rate for people in Michigan that are under the age of 20 still remains low. So again, we want to encourage folks to be up to date, and especially those kids, those children that are between the ages of 5 to 11. The state recently shared data that by mid-November, only about 2,000 doses of vaccine have been given for children ages 5 to 11. So there's definitely a significant opportunity to help protect those kids, but also to help prevent them from spreading COVID to the rest of us, especially because they're in such close proximity in their schools. And then I'll just make 2 other comments about testing and about treatment. And then again, I'm happy to take some questions, Tyler, with our remaining time. There's been a lot of talk about testing. The governor and the federal government has been focused a lot on getting out COVID tests to folks. In every home in the United States can order 4, I believe, at-home COVID test kits through covidtest.gov. And these tests are free. Before using the COVID test at home, I just want to share a few do's and don'ts for users so that they can get a better sense of what we'd recommend. First, if you get a positive test, believe it. You are far more likely to get a false negative than a false positive. And you don't need to get a repeat test. So if you're at home, you're symptomatic, you take a home rapid test, and it says that you're positive, believe it, and do your isolation. You don't need to run to the doctor and get a PCR test because you have COVID. And so it's very much sensitive for detecting positive COVID cases, those rapid tests. If you get a negative test, don't consider it a free pass. We would strongly suggest if you've been exposed, you're known exposed, close exposure, or you're feeling symptomatic, please act as if you have COVID until you're outside the incubation period. And the best time to test for COVID is within 48 hours of developing symptoms. During that time, please isolate from others until you have a negative test. And then finally, if you've been exposed to someone with COVID and aren't feeling symptoms, the best time to test is 3 to 5 days after exposure. So we just wanted to provide some guidance. We are getting a lot of demand for testing. We would really encourage folks, if you're not symptomatic and you need a test, there's multiple resources available online to find out where you can get a COVID test. And a rapid test, of course, are available at pharmacies. Please don't come to the emergency department if you're not symptomatic to look for a COVID test. We want to prioritize using our emergency departments for patients who are sick so that we can care for those patients as they come into the facilities. So with that, Tyler, again, happy to answer any questions and really appreciate the time to speak to your audience today.
Yeah, and thank you as well for your presentation, giving us an update on so many details that are constantly changing and are different with this variant that we have going around currently, the Omicron variant, being that it is so much more virulent than the Delta variant, but even so isn't showing necessarily as severe of outcomes as often as the Delta variant had been previously and continues to. We're joined by Dr. Betty Chu, the Associate Chief Clinical Officer at Henry Ford Health System, on this special COVID-19 update segment of the MegaCast in partnership with the Greater West Bloomfield Chamber of Commerce. And so, Dr. Chu, one of the most important things that we've been hearing continue to be preached by our health officials and being encouraged by people across the board in public health, in government, in business, in education, and and beyond is that need for updating your vaccinations, for getting your booster shots or for getting vaccinated. And you mentioned that there's this change in terminology from fully vaccinated to up to date. For those that have been previously fully vaccinated, they had both of their shots of Pfizer or Moderna, their single shot of Johnson & Johnson, and they're months down the road and they haven't received their booster yet. What are there differences in outcomes that we've seen in those breakthrough cases for people that have previously been vaccinated but have some of that waning immunity versus those that have been boosted since then? And what are some of those key differences in the outcomes of those patients or the cases of those patients should they end up being hospitalized for COVID-19, or even if they're not hospitalized, if there is one?
Yeah, Tyler, so I want to make sure I understood your question. It sounds to me like you're asking if you've been vaccinated and you're fully vaccinated, but you're not up to date, versus if you're up to date, which means you've gotten your booster. Is there any difference in protection between those two groups of folks? And I think we don't have enough data to suggest that there's what we do have data to suggest is that that group that has been up to date, that has booster, has more protection from Omicron. And so, and we know that, again, based on our internal data of folks that are hospitalized, as I mentioned before, of the patients that are in our hospitals that are vaccinated, the majority of them are not what we call up to date on their vaccinations. And, simply it could have been a timing thing for folks. They wanted to get their booster. They haven't gotten their booster yet. They're not up to date. But we certainly know that, especially as the virus evolves and creates more variants, that it's important for us to stay up to date on our boosters. As you may have heard, there's some testing that's being done on an Omicron specific booster, and we won't know if that's going to be effective or not, and we don't know if there isn't going to be a new variant that's going to be coming in the future that the vaccine will need to be pivoted or shifted to. There is some cross protection, of course, between the vaccines towards the variants because of the way that the vaccinations work.
And so we've heard a lot as well, especially in arguments from people that are refusing to be vaccinated or are hesitant to be vaccinated and may have had COVID previously, that they don't want to get vaccinated or they don't feel the need to get vaccinated because they've had COVID and they believe that they have protection from quote unquote natural immunity. There are some indications that natural immunity can provide some sort of help as it does with other viruses, but not nearly as much protection as these vaccines and as the booster shots do. What are some of those key differences between or better yet, what protections can or does natural immunity provide to people from COVID-19, especially these variants, particularly the more severe, with more severe outcomes in Delta and with and the one that's more virulent in Omicron, versus those that have either natural immunity and vaccination or vaccination at this time?
Yeah, so a couple things I'll say is that the name of the game with, of course, vaccination or natural immunity is, do you make antibodies? And those antibodies are, of course, what protect us from future infection and protect us from disease. We definitely know, based on science and all the millions of people that have gotten infected and the millions of people that have gotten the vaccine, that folks that get the vaccine have a much more robust antibody production than folks that have natural immunity. And so while you do confer some protection with natural immunity, you're going to get much more antibodies production and much more protection with the vaccination. And part of why we have to get the boosters is because we know that even with the vaccine, your antibody production wanes over time. It decreases over time, so you don't have as much protection. And that's the intent of getting the booster. It curtails more quickly after natural immunity. So that antibody protection curtails much more quickly after natural immunity. It's rare often that we don't need to have boosters or additional doses. So if we think about the flu vaccine, right, we recommend the flu vaccine on an annual basis because those antibodies that are produced, one, are for specific variants of the flu, but also our antibody protection goes away over time with these vaccinations. This whole discussion, I think, is that there was a lot of misinformation around that it changes your DNA or that it alters your cell function. The vaccines simply cause your own body to produce antibodies, to create antibodies, which is why boosters and being up to date are necessary in order for us to maintain that level of protection, because there's not any permanent change resulting from the vaccine.
Again, we're joined by Dr. Betty Chu, the Associate Chief Clinical Officer at Henry Ford Health System, joining us on the MegaCast in partnership with the Greater West Bloomfield Chamber of Commerce to provide you with an update on where we're at with the COVID-19 pandemic, with the Omicron variant continuing to spread here locally in Oakland County, where we originate our broadcast, as well as throughout the state of Michigan and around the world. Dr. Chu, a couple of key points you also touched on were testing and masking. And so previously on in the pandemic, the encouragement was to wear any mask that you could possibly get that was going to be covering your face and was going to be preventing a lot of particulate matter from getting out into the air and spreading, of course, COVID-19 as it spreads airborne. We've heard more over time, more recently, especially with the more virulent Omicron variant being out in our community, encouragement to switch to either KN95 or N95 masks if possible, as opposed to, but not in absence of necessarily cloth masks or surgical masks, because of how easily spread the Omicron variant is. At this time, what is your recommendation? What is the medical community's recommendation on which masks are best for people to be wearing in order to prevent the spread of the Omicron variant? And do those other masks, if someone doesn't have access to KN95 or doesn't have access to N95 masks, would a surgical mask or a cloth mask still be effective in giving them some protection against Omicron's spread?
Yeah, a couple things that I would say is the mask primarily provides what's called source control, which means that if I'm sick and I have COVID and I put a mask on, it helps protect you, Tyler, if you're standing in a room with me, from decreasing the amount of COVID that I spread to you. If you're sick, then as you know, the masks aren't perfect. They're not a perfect seal. So the more of a seal that you can get, of course, with the mask, the more it's going to protect me from Tyler, who's sick, standing in the room with me. So number one, wearing a mask overall is going to offer you some protection, but it's also going to protect people around you. So part of wearing a mask is about helping reduce the spread if you are potentially an asymptomatic spreader or somebody who's symptomatic. To answer your question directly, first of all, any mask, of course, as to your point, if some people can't get a hold of an N95 or a K95, wearing a mask, I think, is probably the biggest thing I would share with folks, irrespective of whether it's cloth or not. The updated recommendations, though, are reflecting the fact that Omicron is so much more transmissible than Delta. It's multiple times fold more transmissible than Delta. As we know, we've seen how quickly it spread throughout the country. And that really speaks to the fact that wearing a mask that has a better seal is more effective to help you from getting the virus.
And then what about in situations where you are in a small gathering or a moderate gathering with people that you know are vaccinated like you are, or have the vaccine and have received the booster as well? Should we be considering that the Omicron variant, like the Delta variant and previous variants before, has shown breakthrough cases as well? Should we be masking in those situations also, or is there enough of that protection from our vaccinations to prevent severe outcomes or prevent spread of COVID-19 between those that may already be vaccinated and or boosted against COVID-19 if they're interacting with one another?
Yeah, it's a good question, and I get asked that question a lot. As people, I'm going to go to a family event, and I know everybody there has been vaccinated and boosted, and I trust them to tell me if they're symptomatic, they're coughing or sneezing or having some symptoms. Do we really need to wear a mask? And I would say if your activity is low risk, that to me is a low risk activity. Everybody's vaccinated and boosted. You know the people, and they're going to tell you if they're sick or not. So the likelihood of you having somebody in the room who puts you all at risk by not telling you that they have COVID when you guys don't have masks on, I would say it's probably relatively safe in that low risk activity. So we're at the point in the, in the process of COVID where we're trying to have to figure out personally, from a personal and from my family standpoint, what activities am I going to partake in that are high risk or low risk activities? And some of that's also based on my own personal protection, but some of that's based on the environment that I'm in. If I'm in a group of individuals that I don't know well, so if I go to a large indoor meeting today and I'm around a bunch of people that I don't know well, then I would definitely feel more comfortable putting a mask on. even though I've been fully vaccinated, that I've been up to date that I'm up to date with my booster, because I don't know the environment. That's part of why we all have to mask on airplanes right now, or are we walking through the airport, is we just don't simply know who the folks are that are walking around us. And it's not that we don't necessarily trust our fellow citizens, but I think we can all appreciate that when we're in the airport at Detroit Metro, we just don't know who's vaccinated and not vaccinated. And it's much safer for all of us if everybody is wearing masks. And the same is true in healthcare settings. That's why we require a mask in healthcare settings. And many of our patients, as you probably realize, are sick or have comorbidities. And for them to be around somebody who either knows or doesn't know that they have COVID would put them at a lot of risk. So that's why we still require masks in our healthcare settings.
We're joined by Dr. Betty Chu, the Associate Chief Clinical Officer with Henry Ford Health System, in partnership with the Greater West Bloomfield Chamber of Commerce for the special segment of the MegaCast, providing an extensive update on COVID-19, where we stand in this pandemic at this present time with the Omicron variant, Delta variant, and future variants to pop up in our communities and in the state of Michigan as well. And so, Dr. Chu, so critical to preventing the spread of COVID-19, you touched on this in your presentation as well, is testing, especially with a more virulent strain of COVID-19, such as the Omicron variant, being out in our communities. And that's part of the reason why there's been such an effort across the board from the federal, state, and local level to encourage more testing. Of course, the federal test distribution program as well. But much like earlier on in the pandemic, where we had varying time periods being recommended by health officials on when to get tested, how to get tested, and at this moment in time, especially with the Omicron variant in particular, and the way that that's spreading in our communities, if someone is suspicious that they may have COVID-19, obviously they should get tested. But if someone has been exposed potentially to someone with COVID-19, or somebody that they know they were around that may have been around someone else that was COVID-19 positive, what is that timetable that's recommended, or that's most proficient in them getting tested and being in a position to get the most accurate result possible?
Yeah, the time frame would be 3 to 5 days from exposure, to answer your question directly. And we certainly encourage people, if you've had a known exposure, a close proximity known exposure, that that you isolate until you get that test back, until you get some confirmation. Certainly, if you're symptomatic and even if your test is negative, because of, again, the false negativity that especially those rapid tests can have, we would still recommend that you isolate, because no test is perfect, and you could certainly have COVID. It would also help if you did a home test, a rapid test, and you tested negative, but you're still symptomatic. That's a circumstance where getting a PCR test might be useful, because it is a more sensitive test.
And then on the other side of things, if you do test positive and you are quarantining and you are staying distant from others to prevent the spread of COVID-19, at some point you are ready to go back into the world, into your regular life. And as you're preparing to do that, what sort of testing should be undergone as you're coming out from behind your positive COVID-19 test, or your experience dealing with COVID-19? When should people be getting tested again to see if they are still COVID-19 positive before they're returning to regular life out in the public, at work, at schools, and so on?
Yeah, Tyler, it's a really good question, and the answer might surprise you, because there's been a lot of discussion about, is it 5 or 7 or 10 days that you're supposed to stay home and wear a mask and stay isolated if you're COVID positive, and should you get a test when you leave, and if you're not negative, and stay home for longer even though you feel totally fine. As you probably know, COVID tests can be positive for quite some time. I mean, weeks sometimes after you've had COVID. And so for many employers as well as our own, if we have an employee who feels completely fine, who is COVID positive, who's been home for the 7 days, which is our policy, or again, 5 days. I know that some policies for other companies, we have them return to work and wear a mask. And of course, we have a mask policy at work, but we'd ask them to wear a mask. The testing is not as useful anymore. So we don't require testing for employees to come back to work if they are asymptomatic. We have what's called the symptom-based strategy. But that's really no different than any other cold or flu, right? So we're getting to the point where eventually COVID's going to be an endemic. And we eventually have to say to employees, okay, you had flu and you were home for 7 days, but you feel fine. We don't test flu people before we tell them to come back to work. We tell them, you feel fine, come back to work, use precautions, wear a mask. And in our case with COVID, because it's so transmissible, we would just advise them to wear a mask. So we would just tell people to still be cautious, but that the test itself is probably a little bit less useful after you've already know that you're positive, if you feel completely fine. But wearing a mask is probably one of the most important things you can do after a COVID infection for a period of time.
Dr. Chu, we appreciate your time, appreciate your insight and giving us this extensive amount of information on COVID-19, as there's a lot of information, a lot of misinformation and disinformation continuing to fly all around us out there about COVID-19. We've got another minute with you or so before we'll need to say goodbye today. Any last advice or information that would be important for our audience to be considering at this time regarding Omicron variant or anywhere else that we stand in this COVID-19 pandemic?
Well, I guess a couple things that I would say. Unfortunately, it's not over yet. I know we are all exhausted and tired, whether you're in healthcare or you're not in healthcare. I know everybody is, quite frankly, sick of talking about this topic. However, that doesn't mean we shouldn't still be vigilant related to it. We are still seeing a lot of hospitalizations related to the COVID crisis. And we do, of course, have some very effective therapies, whether it's monoclonal antibodies or antiviral therapies. We have a tremendous amount of information that's at the henryford.com website related to testing, vaccines, frequently asked questions information. So, Tyler, I would definitely direct your audience to our Henry Ford website. We have a lot of information to share related to vaccines and safety and pregnancy and those types of things.
Dr. Chu, thank you very much for your time and appreciate all your insight.
Great. Thank you. Thanks for inviting me today.